Hello, I'm Edward Clobaker, a Clinical Director for EPS Health and a GP in Leicestershire. A very warm welcome to all of you and thank you very much for joining us for this EPS Live event, Understanding the Electronic Prescription Service. Just a reminder that the session is being recorded, so those who registered but aren't able to join us now can catch up later. You'll all be sent a link by email to the recording along with material from the session over the next few days. I'm joined today by my colleagues from EPS Health, Michael Kidd, who's the National Training and Optimization Consultant, Thomas Whedon, a Clinical Software Trainer. Mike and Tommy are leading the presentation today. Catherine Clark is a Delivery Project Manager, Tracy Coulter, a Product Manager, Lucy Shepherd, Product Owner, and Catherine Hoyle, Senior Training and Optimization Consultant. We're taking questions via the Q&A function of Microsoft Teams throughout the presentation. Our team will be publishing questions for the discussion or responding via the FAQ document sent out after the event. When you post a question, please include your name and organisation in case we need to get back to you after the event. The advent of electronic prescriptions has been revolutionary for me in my 20 years as a GP and has transformed the way we work in general practice. So I'm now going to hand over to Mike and Tommy, who are going to explain all about it and how it works.
Thank you very much, Edward. Hello, everyone. As Edward said, my name is Michael Kidd and I'm a National Training Optimization Consultant for EPS. I've worked with the company for a little under 1 year now. I've developed a great understanding and expertise within the primary care industry, and especially with EPS Web.
Hello everybody, my name is Thomas Whedon. I'm a Clinical Software Trainer from EPS and I've worked from EPS since December 2019. I've dedicated myself to deliver quality customer-friendly training throughout the UK. Today, myself and Michael will be talking about the electronic prescription service and the huge benefit it has had on non-GP organisations, especially during such a difficult time regarding the global pandemic. We ourselves have played an integral part in kickstarting non-GP organisations with the function and adapting services to provide the same level of care as a GP practice. This wasn't possible before COVID-19, however these services are now taking advantage of the electronic prescribing service, resulting in the reduced patient contact within the UK during the pandemic. Today we'll be looking over the following with you all.
Our first point will cover a brief introduction to the electronic prescribing service, as well as talk to you all about the benefits of the national service and why we would recommend it to optimize how you and your organizations prescribe. We'll then secondly go into the fundamentals of prescribing electronically with the use of the NHS spine and why the spine is so important. Next, we will look to explain what you will need to allow you to prescribe electronically. More specifically, the use of Smartcards, personal demographic service link between your patient record against what is held on the spine, and patient dispenser nominations. We will then dive into how EPS can and is now currently being used within non-GP organisations and clinical services, and the huge benefits this is currently having on our customers since rolling out our EPS Clinical Services project at the beginning of April 2020. Finally, we will go into detail regarding the latest phase of EPS, EPS Phase 4, and explain the new features of this phase and how these will benefit EPS users in the future.
Firstly, let's provide a brief introduction on the electronic prescription service. What is EPS? The electronic prescription service, also known as EPS, enables the electronic transfer of medical prescriptions from a doctor to pharmacists and other dispensers. EPS also provides the electronic notification directly to the NHS prescription service that allows GP and clinical staff to track the status of each prescription produced. Eventually, this will remove the need for most paper prescriptions in the future. The organisation benefits. EPS has generated efficiency for prescribers, as staff can now process prescriptions more promptly, spending less time dealing with prescription queries and manually signing standard paper prescriptions. This efficiency has aided dispensers to reduce the paper and improve stock control in many organisations across the UK. All authorised electronic prescriptions are provided with a unique tracking ID which is entered into the NHS EPS tracker via the NHS Spine portal. This service locates the status of any authorised prescription in the UK and has promoted the economical process that has saved healthcare professionals countless hours per week and has generated the effective structure for patients. The patient benefits. EPS patients can now collect their prescriptions from a specified pharmacy of their convenience. Without the need for visiting the GP, this process has been ideal during the COVID-19 pandemic, promoting the reduction of face-to-face contact. With every electronic prescription being orderable online, patients can turn up to their nominated dispenser without a physical prescription and collect their medication, eliminating the need for reprinted prescriptions should the patient lose their token. Nominated prescriptions are pulled down automatically by the nominated pharmacy, without the need for patients to contact their GP practice or specified dispenser. This allows pharmacists to produce the prescription prior to the patient's arrival. During the pandemic, this has been significantly beneficial for both the patient and the dispenser, as the pharmacist can contact the patient once the prescription is ready, reducing the waiting time for patients within the pharmacy. And finally, we look into EPS throughout COVID-19. During the pandemic, most customers and organisations have reaped the benefits of EPS. GP practices and clinical services have gained the tools necessary to produce electronic prescriptions no matter where the patient's location. This ability has greatly lowered the risk for infection for both patients and staff. EMIS has been working closely with NHS Digital and centralised funding to produce EPS prescriptions in numerous clinical services up and down the country during the pandemic. Myself and Michael have played a key part in ensuring that customers are comfortable with the transition to EPS, and especially during such a difficult time. We are providing round-the-clock support and assistance to organisations that are activated, and the process to delivering customer-tailored training to seek the most efficient use of the service.
Next, we will explain to you the fundamentals and why they're so integral to the process of prescribing electronically. There are two key areas that allow EPS to function: the spine and the personal demographic service, also known as the PDS. The spine supports IT infrastructure within England, allowing the joined-up connectivity between pharmacy teams, GP staff, patients, and others. The spine also permits information to be shared securely through national services, such as EPS, but also the e-referral service and the summary care record. The personal demographic service is a national electronic database of NHS patient details, such as name, address, date of birth, and NHS number, just to name a few, which is also known as demographic information. Each individual record on the PDS contains identifiable data to help care providers identify a patient to facilitate communication with or about them. For EPS to run smoothly, a link to both the spine and PDS is mandatory. This is to ensure the correct patient is receiving the correct medication and that their care record is updated with factual information. If you do not have a match to the personal demographic service when issuing a script, you will not have the facility to send an electronic script and will be asked to resolve any mismatches or discrepancies. This leads us into our next section.
Next, we'll be talking about the prerequisites of EPS, identifying the needs and use of electronic prescriptions. First of all, I want to talk about Smartcards. Smartcards control and measure the secure access to clinical and personal information that only those that have can access. NHS Smartcards are similar to a chip and pin bank card that enables healthcare professionals to access the national services such as EPS, Spine and PDS. Alongside the additional information made available to healthcare professionals, Smartcards also access the patient's PDS. This gives the access for users to consistently update the patient's care record and the personal demographic information that is stored securely on the National Spine database. This accessible information assists healthcare professionals to monitor patients' conditions, forming a contribution to the decisions made regarding the patient's medication or the required treatment. Prior to COVID-19, the only way to access the national system has been the use of a physical smart card. Despite the work of access and logistics hubs radically increasing the production of physical smart cards nationally, there is likely to be limitations of speed and deployment as the demand increases. The solution, however, is rapidly approaching through the use of ISO-sec smart cards or virtual smart cards that have now been permitted by NHS Digital. The ISO-sec virtual smart card virtualizes the physical NHS smart card into the cloud, allowing healthcare professionals to access the workspace and applications using a more convenient form of authentication without the need of a physical smart card. This solution saves significant overhead with the existing physical smart cards and reduces the physical contact with hardware, forming a more sterile environment.
As previously mentioned, the PDS is essential and a link needs to be present for healthcare professionals to action any electronic prescriptions as well as other spinal services. If you find any demographic mismatches or discrepancies between your record and the spine, these can be manually validated to obtain a link with the PDS. Without this synchronization, spinal services will be unavailable for your chosen patient until this has been resolved. However, you will still be able to issue medication electronically with a red PDS, providing the only discrepancies are with the patient's contact number and/or email address, purely as these do not have a direct impact when issuing medication. More personal demographic data such as patient's name, date of birth and NHS number, for example, must be linked with the spine in order to send a prescription electronically. The video in the background, as you can see there, shows how an EMIS web to resolve a PDS discrepancy.
Next we'll be talking about EPS nominations or patient nominations. Patients can have their prescriptions sent electronically to the pharmacy or appliance contractor of their convenience. This is known as an EPS nomination. The patient's nomination information can be obtained from any healthcare organisation using Smartcard access that forms the initial link to the patient's personal demographics. Once the patient has nominated the specified dispenser, healthcare professionals will have the ability to sign and send prescriptions electronically to the patient's nomination, no matter where the prescription is generated. As seen visually in the graph displayed, we are rapidly approaching 29 million patients with a nomination. We have had a big spike in prescriptions that have been issued via EPS at the start of lockdown. We can also see the decline of paper prescriptions during the pandemic, and how the efficiency of EPS has also continued to grow, phasing out the traditional paper prescription. Nominated dispensers can also retrieve the prescription information without needing to scan the barcode of a traditional paper prescription. So once the prescription has been issued to the patient, they can go directly to the nominated dispenser to collect their prescription, providing their name and current address.
Possibly the biggest and most anticipated feature revolves around the ability to select a one-off pharmacy nomination for an individual EPS prescription. This is a valuable ability for any acute or repeat prescriptions when a patient is unable to use their usual nomination for whatever reason. One-off nominations can be used for electronic repeat dispensing prescriptions, where all issues within the prescription will be sent to the one-off nominated pharmacy. At the point of issuing medication, all healthcare professionals will soon have the feature available for one-off nominations. This option will allow the user to choose a pharmacy that is listed within the directory of services, which is also known as the DOS. The selection of a one-off nomination will not affect the patient's current nominated pharmacy or appliance contractor. However, if the patient requests a one-off nomination, and then they change their regular pharmacy nomination before the one-off prescription has been completed by the pharmacy, the one-off prescription will be redirected to the newly nominated pharmacy. It's something that you do need to be aware of. If you wish to use the one-off pharmacy nomination for appliances, this can be done, but an amendment to the medication needs to be made. During the issue of the medication, the DAC box must be unticked within the add a drug sequence. Therefore, the appliances will be sent directly to the selected pharmacy as opposed to the appliance contractor. We are rapidly progressing the enablement of this functionality within EMIS Web. You do not need to request this functionality, and the communication will be sent to your organisation ahead of enablement. At this current stage, we are only able to activate one-off nominations for GP organisations that do not use the EMIS Web dispensing module. More information can also be found on our EMIS Now website. So on the following slides, I'll explain how myself and Thomas have been driven to provide non-GP organisations and clinical services with the EPS functionality at a rapid rate. An account director will be in contact with your organisation to discuss the activation of EPS R2. But if you haven't been contacted and would like to know more, please email talk2@emishealth.com. Working closely with NHS Digital. EMIS and NHS Digital have been working closely since the onset of the pandemic to enable EPS functionality outside of the general practice setting, for example, in extended access clinics, as well as hot and cold COVID-19 clinics. Centralised funding. At such a crucial time, not just nationally, but globally, many non-GP organisations require EPS activating to aid the reduction of physical contact, which minimises the risk of infection, in addition to continuing to provide care to patients outside of the usual GP setting. NHS England have provided funding for the project, meaning EMIS can be responsible for implementation and dedicated training for all new EPS activations for non-GP environments at no cost to the organisations. How EPS has helped our customers during the pandemic. EMIS in total have activated over 60 clinical services with EPS since the rollout, which myself and Thomas have been heavily involved with. This brings the total number of organisations currently using EPS on EMIS to 3,970 out of 4,040, which equates to about 98.2% of our customers. I myself was involved with a rapid system rollout across Herefordshire for Taurus Healthcare that enabled me to deploy EMIS EPS in under 2 weeks, driving seamless patient care. At first, as the first organisation outside London to implement EPS for EMIS Web clinical services, Taurus are true examples of how digital solutions can support federated working across organisations. Lastly, community functionality in the future. Now that EMIS is successfully rolling out EPS within clinical services, the next stepping stone will take us into community services. EMIS has commenced work to develop the EPS functionality for community organisations. As EMIS progresses this development, communication will be shared via EMIS Now and your regional EMIS account directors.
Finally, we'll be looking into the EPS Phase 4 and what new features are available within the latest functionality. So let's give a EPS Phase 4 overview. Phase 4 of EPS allows prescriptions for patients without nominations to be signed, sent and processed electronically. NHS Digital and EMIS piloted Phase 4 at GP practices and dispensers across England from November 2018. The rollout of Phase 4 to GP practices in England started in March 2020, making EPS the default method of prescribing, dispensing and reimbursement of prescriptions in the primary care England. Since April, over 1,500 practices have requested the activation of EPS Phase 4 using our online request form. The feedback regarding the software and the request process has been positive, with a small number of customer raised queries relating to the EMIS Now account. We've reviewed the queries and recently created a frequently asked questions article which should answer the majority of the questions that prevent customers from raising cases with our support team. Next we'll be looking at the non-nominated and any pharmacy EPS prescriptions for Phase 4. Phase 4 is at the point at which EPS becomes the default prescribing, dispensing and processing of claims in primary care prescriptions in the UK. The key changes with Phase 4 is that the default route of all eligible prescriptions will be electronic. There will be two options for patients with Phase 4 is live. Patients will be able to continue to nominate their preferred pharmacy and receive prescriptions as they are with their current EPS service. If no nomination is in place or the patient has a nomination in place but wishes to go to any pharmacy, the option can be selected when issuing the medication. The prescription will be signed using a Smartcard PIN and then sent to the spine. A token will then be printed and then should be given to the patient to take to any pharmacy of their choice. The barcode on this token will be scanned by the dispenser on site, enabling the release of the legal prescription from the spine to process electronically. At present, patients must be provided with the token containing the barcode. During the pandemic, the aim is to reduce the number of patients needing to visit their GP practice as non-nominated prescriptions are electronic. It is possible for the patient to pick up the prescription without a physical token by providing the token ID to the pharmacy. The token ID can be located within EMIS web and provided to the patient. And we'll look into how to order EPS Phase 4 with EMIS. Phase 4 functionality is available on request to your organisation if your organisation already has EPS Release 2 enabled. Online content is available on our webpage EMIS Now, where you can find the request form for activation for your organisation along with further guidance and links that can be provided on request. EPS Phase 4 is available for all organisations where EPS functionality is available. If you do not have EPS Release 2, this must be ordered through customer fulfilment. And finally, we'll look into EPS enhancements. We're just giving a quick update regarding the EPS enhancements that have been released for the effective signing within medicines management. Effective improvements in medicines management. We have performed some work in enhancing the optimization of the EMIS web and how it retrieves patient records when loading medication requests. We have also improved the speed of the signing of EPS Release 2 prescriptions within the medicines management, improving the speed in which EPS prescriptions and awaiting signing tasks can be managed within the module, overall speeding up the signing process. Thank you.
Thank you.
Okay, we're going to move over to some of the questions we've been receiving during the presentation, but perhaps before we do that, Michael, Tommy, could you take us back to slide 13, which had a graph on it of the recent usage statistics for EPS. I'd just like to talk you through that so you can see how some of the prescribing habit has changed. Here we go, during COVID. So you can see here the grey line going along is the number of patients who have a nomination, and at the start of lockdown, which is about half the way across the graph, you can see there's suddenly a fairly sharp uptake in the grey line, indicating that more patients were having a nomination applied to their medical record, which is great news. At that same time, we can see there was a spike in prescription requests. The blue line showing the total number of prescriptions, and the orange line showing all of the prescriptions that went via EPS. Before lockdown, where this vertical peak is, about halfway across, you can see that there is a significant gap between the blue line and the orange line, and that gap means prescriptions that didn't go via the EPS service and therefore will have been printed. And correspondingly, you can see a yellow line towards the bottom of the graph, which is printed prescriptions. So we can see as lockdown came, nominations went up, EPS prescribing went up relative to total number of prescriptions issued, printed prescriptions came down, which is great news. So there was a peak of EPS activity at the start of lockdown, and then things quietened down. We've got 3 further sort of mini troughs over the last few months, and those represent Easter and the 2 May bank holidays when we've had slightly less activity. But the take-home message after that is that you can see the gap now towards the end of the period on the right-hand side of the graph is narrower than on the left, which means that we're getting more of our prescriptions going via EPS, which is really fantastic news and great progress for our prescribing. So we're going to move into some of the other questions. We've got a question, we've had some fairly specific questions about practice mergers and stamp rotation, which we'll get back to the people who've posted those individually afterwards. We're going to come shortly to a question that we're frequently asked about why medication can't be sent via EPS. And then we're going to move on, Tracy, to a question about Smartcards. We've had a few questions about that. So, Lucy, one of the things that we find sometimes is that a prescription can't be sent via EPS, which is quite frustrating for us in practice. And sometimes the first time you know that is when you hear the printer go click, and then it starts warming up, and out comes the prescription. You're thinking, why didn't it go via EPS? Can you talk us through some of the reasons that might mean a prescription can't be sent via EPS, please?
Yeah, absolutely. Thanks, Edward. So as Edward's mentioned, hi, by the way, I'm Lucy. I'm a product owner at EPS Health. So as Edward's mentioned, a lot of practices, even if they are set up for EPS and would normally prescribe via EPS, sometimes you'll find that you go to print a prescription or send a prescription, I should say, and it defaults to printed instead. And there are quite a few reasons why this might happen. So this happening it does often result in quite a few calls to support. So I just thought I'd talk through a few of the reasons why it does happen. So there's some basic ones, as Tommy and Mike have touched on, such as, so you need to have your smart card inserted, of course. You need to check it's actually in properly, because sometimes that does mean that if it's not in properly, you don't get a PDS sync for the patient, and therefore your prescriptions won't go electronically. If you have a different signing user, if you're not your usual stamp, or if you've got stamp user on rotation, you'll need to check that the user who's signing the prescription also has a smart card set up to prescribe via EPS, because if that's not the case, it will also print out. There are also a few different medications that can't get sent via EPS. For instance, if you're prescribing privately, if you're prescribing by instalment prescribing, that needs to get printed out, and it's the same for an FP10 private controlled drug. If you are doing a repeat dispensing batch, that can only be sent via EPS version 2. So if your patient doesn't have a primary nomination, that will be why it's printing out rather than being sent electronically. There are also Schedule 2 and 3 controlled drugs. At some organisations, this can be sent electronically. If your organisation is not configured to do that, however, again, those will print out on scripts. And the last couple of reasons why your prescription might not default to electronic will be that the patient could have an EPS preference set. So there is a setting in EPS Web where you can set the patient to EPS not preferred, in which case the script will print out. And I think that's it for a basic list of reasons. So if you do find that you go to print a prescription and it prints out rather than go into the spine like you expect, then it could be any number of those reasons. I hope that's helpful. Thank you.
Thank you very much, Lucy. We're going to come to the question about virtual smart cards now, and then we're going to talk a little bit about some of the use cases for one-off nomination. Tracy, the concept of a virtual smart card is an excellent one for me as a practicing doctor. Perhaps I may not be able to go to work tomorrow. I may have to self-isolate, or I may leave my smart card at home. So a virtual smart card sounds like a fantastic evolution for us. But the question is, how do I get one? Can you point us in the right direction where users might go if they want to get hold of a virtual smart card? I think are you muted?
Hi, sorry about that. Yeah, sorry. Hi everyone. I'm Tracy Coulter, Product Manager. Yes, great question, Edward. Basically, to obtain your virtual smart card, these can be requested through NHS Digital. What I can do at the end of the session is share the link to their website where the information's held, and users can obviously gather more details and information around that.
Thank you very much indeed.
Thank you.
One-off nomination is something that I personally, as a GP, have been looking forward to for some time, and when this functionality is released, I will certainly be singing from the rooftops because it's great news. And just to talk through some of the use cases that might be helpful to think about here with your EPS prescribing. So if a patient is away from home for some reason and they need to get hold of their medication, perhaps they've gone on holiday and forgotten to take their repeat medication with them, or perhaps they have become unwell during holiday and need something on acute, such as a course of antibiotics or some painkillers, then the EPS one-off nomination function can be used without disturbing the primary nomination. So it'll be very useful then. Other people have been locked down away from home, perhaps with family and looking after them, and it's been useful for them. We're seeing more and more that some patients are choosing a remote pharmacy for their prescribing needs. And that tends to be very helpful for repeat items, which you can pre-order and come in a few days' time. But actually, if you needed something acute, such as some antibiotics for an infection, you might need those more quickly. So another use case for the one-off nomination might be to use that for a pharmacy nearby. Increasingly, we're finding, perhaps with the pressure that was on the prescribing system, that a pharmacy may not have an item in stock, and therefore you need to go to another pharmacy that's not their normal pharmacy. And therefore, the one-off function can be used for that. Also, people may be at work and their normal pharmacy may be closing, say at 6 o'clock, and they need to go to a late night pharmacy to pick something up, or out of hours. So there are lots of use cases we can think of for one-off nomination. I really hope you'll find that feature useful once we've been able to release that. I said we'd talk a little bit about EPS 4, and we'll come to that question in a minute, some of the prerequisites that are needed to have EPS 4. We've had a question about non-DM&D items and the library function in EMIS Web. And as we know, that yellow line I showed with printed prescriptions, a lot of that is driven by non-DM&D items, which can't be sent via the EPS service. So yes, in the last few weeks, we have updated the non-DM&D searches so that you can identify your top 10, 25, 50, 100 non-DMD items which we can surface to, and then you can proactively change, hopefully with your practice pharmacists. We're looking in the future to the possibility of being able to surface all of these non-DMD items in your current medication, which would be very helpful. So Kathy, the message is very clear from NHS Digital, and that is nominate, nominate, nominate. But there are circumstances when EPS4 is the most appropriate thing. For example, a patient doesn't know when or where they'll be able to collect their prescription, so it can be very useful. What would you say the prerequisites are to be able to have EPS4 as a practice?
Hi, so yes, I'm Kathy Clark. I'm one of the project managers. So that's a very good point. There are still circumstances where a patient might not know where they're going to be able to go get a prescription. So I suppose in a similar way to an FP10, where you want to be able to go to where's convenient, but you don't know where that might be. In terms of the prerequisites for using, we've streamlined a process that's on the EMIS Now support centre where you can request activation for EPS phase 4. So the prerequisite for using that route at the moment is that you need an EMIS Now account to be set up, and you need to already have EPS phase 3 or release 2, which is where you can already nominate a pharmacy for a patient, and you can already send your nominated prescriptions. If you've already got that functionality, you can access the EMIS Now Support Centre and fill in a form. It'll ask a couple of questions. So have you liaised with your CCG? Have you read the training materials and the guidance that we've published, and have you spoken to the clinicians at the practice, and you've got an authorising clinician to name in that form? Then that will come through to our deployment team at EMIS, and you will get an email confirmation to say that your practice has been activated. If there's any issues in terms of setting up that EMIS Now account for your practice, we've got some guidance on setting that up as well. And that allows a kind of quicker route to follow through if you've already got EPS phase 3 enabled. If you don't currently have phase 3 enabled, you can contact your CCG EPS lead and the customer fulfillment team at EMIS, and you can get EPS set up through that route. So if you've not already got EPS in place, or you've not got the functionality at the moment to nominate pharmacy on behalf of your patients, and that follows a slightly different route to get everything set up that is a little bit more complicated than if you're just moving from phase 3 to phase 4. Edward,
thank you. Yep. Thank you, Kathy. We've had another EPS4 question that's come in, and that's around the tokens. So perhaps I could ask you to take that as well, Kathy.
Yes.
So the question reads: do all patients require a token for EPS phase 4? If the patient already has a nominated pharmacy, will the patient have to attend their GP surgery to collect the token before attending the pharmacy?
Yes, so EPS phase 4 is an addition to the EPS phase 3 functionality. So that nomination of pharmacies won't change. The patient will retain those nominations to the pharmacies, and enabling phase 4 won't affect that in any way. All this allows is that if the patient doesn't have a nomination, or if the patient would like to be able to take their prescription anywhere, you can select EPS Any Pharmacy, and this will print off a token for the patient. So at the moment, under phase 4, if you've got a pharmacy nominated, there is an option to print a token. It doesn't automatically print, it's defaulted to off, but if necessary, you can print off that token. For phase 4, so you've selected it to override the nomination, so they can go anywhere, or if they don't have a pharmacy, it will print off that token for the patient to take to the pharmacy. In addition to that, if the patient can't come into the surgery, or as we've discussed with the pandemic, trying to reduce footfall, there is you can, in the medication screen, access the token ID to provide that to the patient, and they can take the token ID to the pharmacy for them to pull down that prescription from the spine, which obviously is exceptionally helpful in the current situation. So although it prints off the token, and if possible, please provide that token to the patient, you can provide them the token ID number instead of the physical piece of paper to take to the pharmacy.
Yeah, that's very helpful. There's another question come in about that. Obviously, during COVID, we're trying not to bring patients to the practice unnecessarily, and many practices have used innovative ways of transmitting the EPS token ID to the patient via email or via text. So there's another question here about EPS4, which I might ask you, Kathy, if that's okay, and that's about new practices moving or migrating to EMIS, and how they'll get hold of the EPS4 functionality. So my understanding is the EPS4 functionality has to be requested practice by practice. But if you're migrating to EMIS, or you're a new customer, if a practice want to get hold of EPS4 functionality, how would they go about doing that?
So yes, apologies, I should have really mentioned this. So any new activations to EPS are going directly to phase 4. So we won't move anyone on to phase 3 and then ask you follow the process to go to phase 4. As this has obviously the kind of, I suppose, full range of electronic prescriptions at the moment. So it's and it's the newest piece of functionality. Any new requests for for EPS will directly go on to phase 4. So as it was, it's been discussed, for those that are clinical services moving on to EPS, they're going directly to phase 4, and the same for GP. Any new customers will go directly to phase 4.
Thank you. We've got another question here. Perhaps Lucy might take this, about one-off nominations. Here, it's worth explaining, if you change the nominated pharmacy, not one-off, the impact. Hadn't realised as a user for years, and probably accidentally made things worse for patients. Any sort of comments about that, Lucy, and the one-off functionality there?
So following on from what you mentioned about one-off nominations, Edward, so the impact, I assume you mean if you update a patient's nomination without it being a one-off nomination.
Yes, yeah, that's right.
So yeah, the scenario there would be that you've updated it indefinitely. So if you have updated it outside the one-off functionality, it will leave it with that nomination that you've changed it to, unless you change it back. So I suppose the impact would be that if the patient was then issued a prescription and they weren't aware that their nomination was still on the one that you changed it to, then they wouldn't be able to pick up their prescription from the correct pharmacy, which might result in a few communication issues, and reprints and reissuances. So I think that does sort of hammer home how useful that one-off nomination functionality is, and how important it is to sort of be aware which part of the system you're using to change the nomination. And hopefully this session has been useful to explain that.
Yeah,
hopefully that answers the question.
Thank you, Lucy. We've got one more question about EPS and the activations, which I'm going to ask Kathy. The customers are clearly wanting to take this up, And in fact, I saw something that came in through the email from support saying 1,500 practices have taken up EPS full functionality, which is fantastic. And that's alongside the statistic that 98.2% of our customers now use the electronic prescription service is fantastic. So if a practice has completed the form to switch to EPS full, Kathy, what happens next, and how long does this process normally happen?
So yeah, so once the in terms of updating the form to move from phase 3 to phase 4, that is quite a quick turnaround. So it's normally we've been enabling in about 48 hours. So it's been a very fast turnaround from putting those changes through. So once the form gets updated, it goes through to our deployment team, and we schedule in the time to activate. Once we've completed the activation, an email confirmation will be sent out, and once that email's confirmation is sent out, if there will be, unfortunately, you need to log out of EMIS Web and then back into EMIS Web, but then the functionality will be available.
Thank you very much, Kathy. We've got one more question that Lucy's going to take for us. Do you want to talk us through that question and explain that one, Lucy?
Yeah, so I just spotted a question from Tiffany, which is asking about dispensing practices. So the question reads, as a dispensing practice, if we send a prescription to EPS, we select EPS Direct to pharmacy, but this then needs to be changed again before a GP signs it to be able to go to EPS, as it will automatically default back to dispensing. Can this be overridden? So the way that the prescription defaults work at the moment at a dispensing practice is that you're all configured for dispensing and that's all set up, and then if you have the patient individually configured to be a dispensing patient as well, that means that any time you issue a prescription to that patient, even if the organisation is also configured for EPS, it will by default go to dispensing, because dispensing is the sort of overriding setting, if you like. So that does mean that when you get to the point of issuance, you do need to change it to EPS if you want it to go via EPS. So that is how it works currently. One thing to do if you have a certain patient who you need it to send via EPS every time is to go into the patient configuration and lift the dispensing setting, so set it to no, and that means for that patient the prescription will always default to EPS or printed. So hopefully that answers the question. We do have the dispensing doctors functionality, which will mitigate that problem. I can't comment on how widely that's rolled out at the moment, though. But hopefully that in the meantime that does answer your question.
Thank you very much, Lucy. So what's clear from these questions and themes coming through is that many of our users are already engaged with the EPS, and they're looking forwards to the new functionality, one-off nomination, EPS for getting the prescription tokens to patients not in paper, reducing their paper printed prescriptions, virtual smart cards, and this is very much the future direction of how we'll be working and how the electronic prescription service is evolving. So I'd like to particularly thank Mike and Tommy for their excellent and informative presentation. Thank you very much. And also to all my panel colleagues from EMIS Health for giving up their time today and in the preparation towards today. We will look forward to seeing you at another EMIS live session over the next 2 weeks, and hope you'll be joining us for some of those. And we will be sending out a post-event email to you with your access to the recording and the frequently asked questions. So thank you again very much for joining us for this session, and good afternoon.